Ever wondered why your doctor scribbles on a piece of paper and hands it to you after a consultation? Many of us have this idea that a prescription is just a doctor's note for medication. But let's debunk that misconception right off the bat. A prescription is not just a shopping list for your pharmacist. It's a legal document, meticulously crafted with your health in mind. Every symbol, every term, and even the layout hold significance. It's not just about what medication you need, but also the dosage, the frequency, and even specific instructions on how to take it. Not to mention, it also serves as a vital communication tool between healthcare professionals. So the next time you look at that piece of paper, remember, it's more than just a list. Now that we've cleared the air on what prescriptions are not, how about we dive into what they truly are? A prescription, in its simplest form, is a written order from a physician or other authorized healthcare provider. But it's much more than just a piece of paper. It's a crucial communication tool, a bridge that connects the doctor's decision to the pharmacist's action and ultimately, the patient's health. Let's break it down. A prescription typically consists of 4 parts: the superscription, inscription, subscription, and signature. Starting with the superscription, this is where you'll find the date and patient's information. It's a vital part, ensuring that the correct individual receives the right medication. Next up, we have the inscription. This is the heart of the prescription, where the doctor documents the name and strength of the medication. The inscription is an essential part of a prescription, because without it, the pharmacist would not know what medication to dispense. Then comes the subscription. This section contains instructions for the pharmacist, detailing how many doses or units of the prescribed medication should be dispensed. It's like a recipe for the pharmacist, guiding them on how to prepare the medication. Lastly, we have the signature, also known as the signatura. This is where the doctor provides instructions for the patient on how to take the medication. It's written in a code that pharmacists understand, but it's also usually translated into plain English for the patient. So, from the superscription to the signature, each part of a prescription serves a unique and vital role. They work together in harmony to ensure that the patient gets the right medication in the correct dosage at the right time and with the appropriate instructions. But remember, a prescription isn't just a piece of paper. It's a critical piece of the healthcare puzzle, a lifeline, if you will, connecting doctors, pharmacists, and patients. It's an embodiment of trust, a promise of care, and a testament to the intricate and beautiful machinery of modern medicine. Understanding these parts will help you understand the prescription as a whole. So, next time you hold a prescription in your hand, remember the journey it represents, the lives it touches, and the health it safeguards. Did you know there are different types of prescriptions? Yes, indeed. Let's dive right into it. First off, we have electronic prescriptions. These are essentially digital versions sent directly from your healthcare provider to your pharmacy. They're fast, efficient, and minimize errors that can occur with handwriting. Plus, they're eco-friendly, no paper required. Then, we have the more traditional paper prescriptions. These are handwritten by your physician and given to you to take to the pharmacy. While they may seem a tad old-fashioned in our digital age, they still serve a crucial role, especially in areas with limited internet access. Next up, we have telephone prescriptions. These are verbally communicated over the phone from a healthcare provider to a pharmacist. They're often used in urgent situations where there's no time to wait for an electronic or paper prescription. However, due to the risk of miscommunication, these are typically limited to non-controlled medications. Last but not least, standing prescriptions. These are ongoing prescriptions that allow for a set amount of medication to be dispensed over a specified period. For instance, if you have a chronic condition like high blood pressure, your doctor might write a standing prescription for your medication that lasts 6 months or even a year. This means fewer trips to the doctor for prescription renewals. So as you can see, each type of prescription has its unique characteristics. Electronic prescriptions offer speed and efficiency, while paper prescriptions can be crucial in areas with limited tech access. Telephone prescriptions provide a lifeline in urgent situations, and standing prescriptions ensure continuous care for chronic conditions. Different types of prescriptions serve different purposes and are chosen based on the situation. Always remember, the goal is to ensure you receive the right medication in the most convenient and efficient way possible. In the end, it all comes down to providing the best possible care for you. Getting a prescription is one thing, responding to it is another. Now let's dive into the process of responding to a prescription. It's not as complicated as it might seem, but it's crucial to get it right for the sake of your health. Once you have a prescription in hand, the first step is to take it to a pharmacy. This can be a physical location or a virtual one, as online pharmacies have become quite popular in recent years. Remember, the choice of pharmacy is yours, so pick one that is convenient and trustworthy. When you present your prescription, the pharmacist will begin the process of filling it. This involves checking the details of the prescription, confirming the medication, dosage, and directions, and ensuring there are no potential drug interactions with other medications you may be taking. This is a good time to ask questions. Don't hesitate to inquire about anything that's unclear. This could be about the medication itself, the dosage, the schedule, or possible side effects. Your pharmacist is a knowledgeable resource, and it's their job to provide clarity and peace of mind. After your prescription is filled, the pharmacist will provide you with specific instructions on how to take the medication. This will align with what is written on the prescription by your healthcare provider. It's important to follow these instructions exactly as they are given. Remember, medication works best when taken as directed. Skipping doses, taking more or less than prescribed, or stopping medication without consulting your healthcare provider can lead to less effective treatment, potential side effects, or even serious health risks. Lastly, keep an eye on your medication supply. When it starts to run low, it's time to consider a refill. Some prescriptions come with refills, while others require a new prescription from your healthcare provider. If you're unsure, check with your pharmacist or healthcare provider. Responding correctly to a prescription is crucial for your health. It's not just about taking a pill or applying a cream. It's about understanding your treatment, being proactive in your healthcare, and ensuring that you're taking the right steps to get the best possible outcome. Ever wondered why your medications cost what they do? It's a question that's crossed the minds of many, and today we're going to delve into the factors that influence the pricing of a prescription. Firstly, let's talk about drug development. It's a costly and time-consuming process that begins in the lab and ends in the pharmacy. From research and development to clinical trials, right through to manufacturing and marketing, the journey of a drug is a long one. And all these stages incur costs which inevitably get passed on to the consumer. Next, let's consider the type of drug. Brand name drugs, which are those patented by a pharmaceutical company, tend to be more expensive. This is because the company needs to recoup the cost of developing the drug, and they also need to turn a profit. On the other hand, generic drugs, which are essentially copies of brand name drugs, are typically cheaper. They don't have the same development costs, but they do need to meet the same quality, strength, and performance standards. Now let's not forget about market competition. When a brand name drug's patent expires, other companies can start producing generic versions. This competition can drive down the price of the drug. But if a drug is still under patent, or if it's a specialized drug with few alternatives, the manufacturer can set the price higher. Lastly, we must mention the role of insurance. Depending on your coverage, your insurance might cover a significant portion of your prescription costs. But if you're uninsured or your insurance doesn't cover the specific medication, you'll have to pay out of pocket, which can be a significant expense. So, in a nutshell, the pricing of a prescription is influenced by the cost of drug development, the type of drug, market competition, and insurance coverage. It's a complex web of factors that can make the price tag of your medication seem baffling at times. Understanding the pricing can help you make informed decisions about your healthcare. After all, knowledge is power, especially when it comes to navigating the world of prescription drugs. We've covered a lot of ground today, so let's summarize what we've learned. We've delved into the anatomy of a prescription, understanding that it's more than just a piece of paper. It's a crucial document that includes the patient's information, the medication prescribed, the dosage, and the frequency of intake, along with special instructions if any. We also explored the different types of prescriptions, namely paper, electronic, and telephone prescriptions. Each has its unique benefits and regulations. Next, we learned how to respond to a prescription, highlighting the importance of reading it carefully, following the instructions, and asking your pharmacist questions if anything is unclear. Finally, we demystified prescription pricing, explaining that it varies based on factors like the type of medication, the dosage, the pharmacy, and your insurance coverage. Remember, understanding your prescription is a step towards understanding your health. Subscribe for more.